Hi, everyone. Welcome to Uptown TV, your go to media platform for community discussions and updates on the latest trends in lifestyle, entertainment, music, and arts, fashion, parenting, and of course, many more. And again, with me today is my co host, Carla. Hi, Carla.
Hi, Wenny. I hope you're doing great and the rest of the community as well. Alam mo, Wenny, I'm thrilled to have our episode today because we're going to talk about music. Alam mo naman na I'm a music lover. Yeah. And I know that there's music for our every mood, whether masaya tayo, sad, galit, anxious, nervous. Ang music talaga, it's there to help us soothe our soul.
Yes, Carla. Actually, totoo talaga yan. Kasi, I'm very happy to introduce our guest right now kasi he is a certified therapeutic harp practitioner. And actually, Carla, this is my first time na narinig ko to eh. First time, I think it's the first time in the Philippines. And, he's a harp practitioner and he uses music as therapy for cancer patients. Sobrang it's something very new here in the Philippines. He is also an instructor in De La Salle College of St. Benilde School of Design and Arts, and he has lectured in various fora on music and therapy. So I am thrilled to introduce our guest for today, Mr. Ryan Villamor. Hi, Ryan.
Good morning. Hi, Winnie and Carla. Thanks for inviting me here.
Thank you also for giving us some time. Ryan, welcome to Uptown TV. To start, why don't you tell us exactly what it is that you do when it comes to music therapy? Can you walk us through the process of this?
There's a misconception about music therapy and therapeutic harp music, and I know it sounds the same, but they are quite different. Because sa music therapy kasi, you use you use the musical activities as part of the therapy. So meaning, it's a goal oriented, and it has a program na meron siyang time frame. So ganun naman ang nature ng therapy. Merong goal tsaka merong time frame. Like for example, 3 months or 1 week or in a month na dapat ganito yung maging result ng pasyente. Dapat mag-improve yung dapat i-address. Ngayon, sa therapeutic music naman, it's not the musical activity itself. It's the sound that as a therapy. So yung intrinsic value or yung intrinsic healing properties ng sound or yung resonance or the sound of the harp is the therapy itself. So you can also say that it's a sound therapy. So yun ang pinagkaiba niya. And sa therapeutic music din, you use the live sound, the live musical playing, yung live harp music ang nagiging therapy para i-address yung like emotional or physical needs ng pasyente.
Wow, it's amazing, ano? So is there a scientific data that, yung music therapy or yung sound therapy, it really helps in the recovery of the sick?
Yes. They have done a lot of research already in United States, in Canada, and in Australia, and also in Europe. Yeah. Meron na siyang mga research-based studies talaga. Actually, nag-start ang music therapy after the World War II, mga around 1950s. Pero yung sound as therapy, nag-start lang sa mga around, itong heart therapy, mga 1970s. Kasi na-discover nila na yung tinatawag ng yung psychoacoustics, na yung sound may effect siya sa brain activity. So, meron na siyang mga research-based sa US. Marami na.
How about dito sa Philippines? Is there already like a group or like an organization or something that's providing these services? How many are you in the industry?
As of now, Wala pa. Actually, ako pa lang yung nag-i-start nitong nag-i-introduce ng Harp therapy. So, ayun. So, I just natapos ko lang yung studies ko nitong October lang. And then, ngayon pa lang ako talaga nag-start na i-introduce. So, hopefully, yeah, may introduce natin sa mga doctors and medical community.
Can I ask, Ryan, where did you study
Um,
harp therapy?
Yan, thank you, Winnie, sa question mo. I studied harp therapy at International Harp Therapy Program sa San Diego, California. Actually, it's an online correspondence course. So, it's synchronous and asynchronous. Pero meron kaming module na nagpunta ako sa Hong Kong kasi masyadong malayo yung US. So, yung mentor pumunta sa Hong Kong, then nagpunta ako sa Hong Kong para dun sa experiential module. So, at the same time, meron din siyang, actually dalawa yun eh. Sa US, yung school ko mismo is International Heart Therapy Program. Tapos meron silang parang certificate, it's a board that certifies the school. So the it's called National Standard Boards of Therapeutic Musicians. So accredited siya. So it's really an organization of therapeutic musicians, not just the harp. So marami ding mga ibang instrument. But for my program, we use the harp as a therapeutic instrument.
Mm.
So I have a question. Um, when you do the harp therapy, what does that um, what does that include? Like how specific number of hours? What kind of um, music or pieces that you have to play? Is there a specific set that you have to follow for that?
Ganito yan. Number one, siguro kailangan muna natin malaman yung so what's the difference between a musical performance and a therapeutic music sessions? So magkaiba kasi yan eh. Kasi sinasabi nila pag therapy, so kailangan mababagal, di ba? Patugtog ka lang ng mga yung mga tugtog sa spa, therapy na yun, di ba? Basta mababagal, basta nakakantok. Pero hindi kasi ganun yun. Harp therapy is not it's not an atmospheric music or yung parang background lang na, alam mo yun, parang pipe in background lang na nandyan, tapos na re-relax ka. Hindi siya ganon. Ang therapeutic harp music compare sa musical performance is music is tailored to the needs of the person. Meaning, it has a lot of observational sa pasyente tsaka sa recipient ng music. Unang-una, pag ang therapeutic music or therapeutic harp music is nakabase siya sa breathing. So pag tumutugtog ako ng harp, nasa harp therapy session ako, pinagmamasdan ko yung breathing, yan yung mga ina-address, yung breathing pattern, yung heartbeat, tapos at the same time yung kailangan well-informed ka dun sa blood pressure, at saka yung we are also trained to observe the facial expressions, yung mga minute movements ng pasyente kasi yung goal ng therapeutic harp music is to accompany the patient through music. So it has a lot to do with empathy, or we call it empathic listening through music. We don't use words to communicate with the patient, lalo na pag yung patient ay sobrang in pain. But we use music to accompany them. Meron ng merong isang quote ni Hans Christian Andersen
Mm.
na when words fails, music speaks. So, yun yung I think yun yung yun sana na nasagot ko ba yung tanong mo. So, yun yung ibig sabihin ng therapeutic harp music at saka yung session na sinasabi mo. And with regards doon naman sa duration, depende naman. Pero sa experience ko, usually it take 15 minutes for the person, for the recipient or the patient to be entrained. So, yung kanina sinasabi ko na the music is tailored to the needs of the patient, hindi lang yun. There is also what we call entrainment. So entrainment is all about synchronization. So when I play for the patient, I just don't play a song na parang nag-entertain lang. So my training, I was also trained to observe and synchronize how I breathe with the patient. Kasi yung music is breathing. Music life yan, di ba? Since sinabi na, music is life. Pero yun lang yung alam natin, it's just words. So, what is really music is all about? So, but when it comes to therapy, so music is breathing. So, yung rhythm ng music ko, sinasabay ko sa breathing ng pasyente. At the same time, yung breathing ko din, kasabay din ng music ko. Kasi kung ano yung, um, what do you call this, kung ano yung mind state ko, yun din yung magiging output ko sa music. Tapos at the same time, yun yung ibibigay ko sa pasyente. Pero actually, hindi naman talaga binibigay sa pasyente. Actually, binabalik ko lang sa pasyente. Kasi yung breathing and all the information I got from what or how should I facilitate the music depends on the state of the well-being of the patient. So, hindi siya yung ako yung nagde-decide para tutugtugin ko, ganito siguro, ganito tutugin ko. Pag-ino-obserbahan ko yung pasyente. So, kung, for example, bigyan ka natin ng example. Yung understanding na sa therapeutic music, yung basic rhythm in therapeutic music is at least nasa mga 60 beats per minute ang music mo. So, ganun siya kabagal. Pero depende sa situation. What if kung yung pasyente is um, for example, dialysis. Kasi nakatugtog na ako ng nasa session ng dialysis. Hindi siya dialysis, pero para siya dialysis. Ang tawag nila plasmapheresis. So, nagpapalit ng blood.
Mm.
Sabi sa akin ng doktor, hindi dapat bumaba ang blood pressure niya. Dapat nga high blood pressure, dapat mas mataas or normal para mas makacirculate, mas mabilis yung mas smooth yung pagpalit ng dugo. So yung entrainment na gagawin ko doon, dapat ang tugtog ko hindi mabagal. Dapat mas mabilis siya. So yun yung sinasabi ko kanina about sa duration and yung entrainment. Yeah.
Very well said, no, Ryan. And yeah, it's really true. Music kasi is really reflective of the soul,
Mm-mm.
you know. Before we end our discussion and before you will perform live, I have one last question.
Mm-mm.
Yun. So, you've mentioned earlier na this is the first time that we have heart therapy in the Philippines and that you plan to incorporate heart therapy in medical practice. How do you
Yes.
plan to do that? What are the
Um,
steps that you're going to do that?
okay, first of all, right now I'm working with a doctor. His name is Dr. Edwin Bien. So I've been working for him since I started studying the heart therapy noong 2015 pa. But it was on and off kasi nga nag-aaral pa ako. So hindi ko pa talaga siya pwedeng i-announce publicly. So ngayon nag-graduate na ako, so I'm already announcing it publicly. Yeah, I'm working with Dr. Bien, and I've done a number of presentations already in University of the Philippines, sa College of Music sa UST, tapos sa mga ilang doctors. Last year, I presented uh, it's like a demonstration and information about heart therapy dito sa St. Luke's. So, that's what I'm doing right now. Nagpe-present ako ng mga workshops, and I'm also working on my upcoming website. So, dun sa website na yan, it's called ryanvillamormusic.com. Dun makikita nyo lahat ng information about heart therapy. Meron akong video doon and all the narratives. And may journals din ako sa mga patients ko kasi meron na rin akong mga experiences like my internship. I've done 80 to 100 hours of internship at Adventist Adventist Medical Center. So I'm not saying I'm super expert, but I'm speaking out of my experience na I really witnessed how music can affect the well-being of the person, especially yung mga may sakit, and they can really help yung gift of music sa kanila.
Yes. Galing, no? And also, you can probably do presentations on medical associations. Kasi magkakasama na yun eh. It's an organization. So you can really do a presentation for them. And, they can probably incorporate it in the practice.
Yeah, sana.
Mm-mm.
Sana.
And you
Okay.
the upcoming website, they will also see the rates. Kung paano ba yun? Ano, yung mga details on how to avail of your service.
Okay. Thanks sa pag-i-inquire, Carla. Yung website ko, actually, it's not just all about herb therapy. Kasi before I become a therapeutic harpist, actually, until now, I'm also a musician myself. I'm also a performer. I'm an artist. So, parang dalawang persona yung ginagalawan ko ngayon. Yung isa is clinician musician. That's how we call it. Clinician musician, meaning you practice music in a clinical setting, and merong training for that. This is yung program ko nga. At the same time, I'm also an regular artist musician who perform, compose music, share music publicly. Yung website ko, nandun yung harp therapy services ko, information about harp therapy, by affiliations, and pati yung services ko sa music entertainment. Nandun din yung Ryan Villamor Music. Kasi nagbibigay din ako ng services sa weddings, mga special events, ganyan. So, nandun yung gallery ko and videos ko. Yung regarding the rates, they can email me about it.
Ayun. So they can just go to your website for all na gustong mag-inquire. Is it active na yung website? Is it up and
Um,
running?
hindi pa active, pero hopefully by this week, yeah.
Ah,
Siguro mga by Friday or Wednesday,
okay.
yeah.
Yes, yes.
Malapit na siya,
Malapit
malapit
na,
na.
oo.
Pinapolish ko pa.
Mm.
Yeah. For the meantime, they can message and check your Facebook page,
Yes.
Facebook business page.
Yung,
Yes.
yun, dalawa din yung, parang dalawang persona. Ang weird. Anyway, yun. Yung isang page ko, Ryan Villamor Music, is dedicated for music entertainment, sa art. Yeah, I'm not saying harp therapy is not an art, but more entertainment. Yung isa naman is Ryan Villamor Harp and Healing. So, for now, kasi hindi pa publish yung website ko. So, nandun ako nagpo-post ng mga information about heart therapy. Meron din akong videos doon that I've been playing for sa may cancer na child. Yeah. And also dun sa may isa din ng adult na nagpo-play din ako. Yeah. Yung harp therapy session ko mismo. But of course with the permission from the relatives. Yeah. But you can see their face actually, except for the child. Yeah.
Ayun.
Wow. Yun. Actually, Carla, I'm very excited na to hear the
Yes.
live, harp therapy session. So, yes, maybe you can play one for us right now.
Sige, sure, why not? It's an honor for me to share my music with
Thank
you,
you.
Carla and Mimi. Ay, last na lang, pwede ba ako mag-plug?
Sure.
Ayan, please, you can check my, yung Facebook page ko, you can like the Ryan Villamor Music and Ryan Villamor Harp and Healing, and my Instagram, Ryan Villamor Music, and my YouTube channel, Ryan Villamor Music din. Actually, searchable naman ako sa Google. Just search those social media accounts. Wala lang akong Twitter, kasi hindi ako nagti-Twitter. And yeah, sa SoundCloud din, I also have Ryan Villamor Music. O Ryan Villamor, just type my name and it will pop up. Ayun, sige.
Yay.
I-start na ako.
Wow, grabe.
Oh my.
Tissue, gano'n. Naiiyak na ako, gano'n.
Oo, actually,
Alam mo
when I listened, yeah, ikaw muna, Carla.
hindi kasi parang ano, heart parang ramdam ko siya tagos sa puso ko yung ano, yung mga notes niya, ganyan. Sabi ko, parang kung di lang ako naka-video ngayon, umiiyak na ako, alam mo yun? Parang gano'n yung mga pinagdadaanan ko. Pero what I mean
Oo.
is, kumbaga, if it really penetrates your soul yung mga notes na yon. Yun nga tama yung sinabi nga ni Ryan na you don't need words
Non-words
to
music. Yes.
comfort a person or to
Non-words music.
accompany the person. Yeah, kahit music lang talagang minsan mas effective pa nga yun 'di ba? Yung instead na may
Mm.
naririnig kang words, mas maganda pang music na lang 'di ba? Yung kaya tuwang-tuwa ako
Eh,
so much for
yeah. Ako naman, no, so sobrang very short presentation, pero when I heard it, para akong napunta sa ibang dimension. Alam mo yung para akong nakapag-soul search ng mabilis.
correct.
Parang ganun eh. Very reflective talaga siya sa mood ng tao. Ano? And it really reflects on the soul of the person. Tagos talaga siya sa puso. Ang galing. Thank you very much, Ryan, for giving us this opportunity. It really is amazing. And I think na itong ginagawa mo right now, this should be something na kailangan malaman ng buong mundo. And let's start here in the Philippines. Kasi dito nga sa Philippines, wala pa nga naman talaga and you are the first. And I think this is a perfect opportunity for us to drive awareness and campaign in regards to Harp therapy, especially to cancer patients. Thank you very much once again, Ryan.
Thank you again, Carla and Winnie. Thanks for inviting me here. It's really an honor and a privilege for me to share my music with you and to talk about this art therapy.
Thank you so much and we wish you the best of luck and we hope na mas dumami pa yung maging aware sa heart therapy kasi maganda talaga siya.
Thank you. Thank you, Carla.
Thanks, Ryan.
Thank
See
you.
you really soon.
See
Bye.
you.
Yeah. See you soon.
So there you have it, guys. We hope you enjoyed another episode of Uptown TV. Should you have any specific topics you want to talk about, please message us in our social media handles in Facebook, Instagram, and YouTube at Uptown TV Media. Follow us, like, and subscribe for more informative discussion.
Stay tuned for our next episode here in Uptown TV. This is Winnie.
And this is Carla saying adios, ciao, and goodbye.